Hey guys, it's Skylar, and in this presentation I will be going over the effects that aging has on the respiratory system. I will cover how aging affects the structure, physiology, and immunology of the respiratory system. I will also cover the pathophysiology behind the decline of the respiratory system in geriatric individuals, as well as some key education points to help inform geriatric patients of what's going on and how to prevent what's going on. Brett Alvis, an assistant professor of anesthesiology and critical care, and Christopher Hughes, who also is an assistant professor of anesthesiology and critical care medicine, performed a research study to look at the physiologic considerations in geriatric patients. For the sake of this presentation, I am only going to be covering the respiratory section of the study that deals with the pathophysiology of the effects of aging and the respiratory system. So the functional residual capacity of the lungs increases by 1 to 3% per decade. The residual volume increases by 5 to 10% per decade. Because the total lung capacity remains unchanged, there is a decrease in vital capacity. This decrease in physiological reserve increases geriatric patients' vulnerability to infection and impairment. Aging also affects gas exchange properties. Arterial oxygenation gradually declines with aging, likely secondary to an increase in ventilation perfusion caused by a decrease in alveolar surface area and the premature closure of airways. Elderly subjects will have a higher tidal volume and a lower tidal volume, and a higher respiratory rate than younger subjects. There is approximately 50% decrease in their response to hypoxia and hypercapnia and a decrease in the diffusion capacity of the lung. Increased ventilation is often required to compensate for the decreased efficiency of gas exchange. Along with these changes in the lungs, there are important changes seen in the upper airway. There is a loss of muscular pharyngeal support, making the elderly muscle more susceptible to upper airway obstruction. There is also a decrease in respiratory effort in response to upper airway occlusion. Protective mechanisms of coughing and swallowing also diminish with time, making a geriatric individual more at risk for aspiration. A presumed explanation for these changes includes peripheral differentiation along with decreased central nervous system reflex activity. I just thought this picture was interesting because it really shows how aging causes a decrease in vital capacity of the lungs. As you can see in the younger picture, the lungs have more airspace. They look fresh and pink, and as you get older, the color kind of goes away and the space for the air to be really diminishes. A few things that would be noticed about the respiratory system in geriatric patients would be a potential change in shape of the rib cage due to the stiffening of the chest wall, diminished lung sounds that could be caused by an infection or just simply because of weakening of the respiratory muscles. Like I stated on the previous slide, geriatric patients will tend to have a higher respiratory rate compared to those younger patients. There will also be obvious dyspnea on exertion because of the decreased vital capacity and the weakened respiratory muscles. And lastly, you will see a decreased cough and mucus foreign matter clearance. Now, these aren't the only things you'll see in an assessment, but these are some of the big ones that would stick out right away when doing an examination on an elderly patient. In our textbook, Tui and Jett state that the respiratory system is the vehicle for ventilation and gas exchange, particularly oxygen into and carbon dioxide out of the blood. Now, we all already know this, but what some might not know is that the respiratory system matures by the age of 20 and then begins to decline even in healthy individuals. The specific changes that happen are a loss of elasticity resulting in stiffening of the chest wall, inefficient gas exchange, and increased resistance to airflow. The biggest change that happens to the respiratory system as an individual ages is the efficiency of a person's gas exchange. The change in efficiency might be felt or seen in normal day-to-day activities, might not be felt or seen in normal day-to-day activities, but may become more evident when the individual is confronted with a sudden demand for oxygen. These changes that occur in the anatomical structures of the chest and altered muscle strength can affect an individual's ability to cough and forcefully expel anything that could possibly be obstructing the airway. Combine the fact that the individual cannot cough forcefully enough to expel anything from their airway with less effective respiratory cilia, and this individual is at high risk of potentially getting life threatening infection or even aspirating. With all this said, respiratory illness in older adults is of the highest importance. I like this picture because it makes the respiratory system seem so simple. It gives oxygen to the blood. For people that don't really know what goes on, this is a big one just to let them know that they need to be taking care of themselves, because this is how their blood does get oxygen and get rid of carbon dioxide, is through their lungs. Gulshan Sharma and James Goodwin conducted a research study to look at the effect of aging on the respiratory system's physiology and immunology in 2006. What they discovered was the respiratory system undergoes various anatomical, physiological, and immunological changes with age. These structural changes include chest wall and thoracic spine deformities, which impairs the total respiratory system compliance, leading to an increased work of breathing. With aging, there are structural changes to the thoracic cage causing reduction in chest wall compliance. Age-related osteoporosis results in reduced height of the thoracic vertebrae. Stiffening of the thoracic cage from calcification of the rib cage, and age-related kyphosis from osteoporosis reduces the ability of the thoracic cage to expand during inspiration and places the diaphragm at a mechanical disadvantage to generate effective contraction. The lungs lose their support structure, causing dilation of the airway spaces, which is called senile emphysema. Respiratory muscle strength decreases with age and can impair effective cough, which is important for airway clearance. Like we already stated, the lung matures by age 20 to 25, and thereafter aging is associated with a progressive decline in lung function. The alveolar dead space increases with age, affecting arterial oxygen without impairing the carbon dioxide elimination. The airway receptors undergo functional changes with age and are less likely to respond to drugs used in younger individuals to treat the same disorders. Older adults have decreased sensation of dyspnea and diminished ventilatory response to hypoxia and hypercapnia, making them more vulnerable to ventilatory failure during high demand states, i.e., heart failure and pneumonia. And lastly, the immunologic changes. As an individual ages, they have greater percentage of neutrophils and a lower percentage of macrophages compared with younger adults. This age-related decline in macrophages puts older adults at higher risk for infections, since their cells do not make enough macrophages in order to fight the bacteria that are invading their bodies. Sustained inflammation of the lower respiratory tract may predispose older adults to increased susceptibility to toxic environmental exposure and accelerated lung function decline. As an individual ages, the lungs are less able to recover after exposure to smoke, harmful chemicals, and even infections. For most geriatric individuals, respiratory problems are very prominent. So here are some education points that we can give these individuals in order to maintain as healthy a lifestyle as possible. If they smoke, they need to stop. Smoking is a major cause or factor for just about every respiratory problem in the book. So it is very important that we reiterate over and over that smoking cessation is very important in order to halt or even treat any possible respiratory issues. Next would be cough enhancement. This just means individuals need to be coughing more frequently to hopefully rid some of that unwanted mucus that's stuck in their airways. Individuals that cannot effectively cough up secretions and clear their airways need to see a doctor and a respiratory therapist in order to have some treatments done to help clear those airways effectively. Next would be hydrate and mobilize. It seems simple, but adequate hydration will no doubt help loosen secretions that could be stuck in the individual's throat or airways. And mobilization is very important because not only does it aid in the loosening of secretions, it helps the lungs be more effective by letting the individual be able to do normal activities throughout the day and not be as dyspneic as they were before. This is just a funny pun for you, and I hope it makes you smile for listening throughout this whole presentation. These are just your lungs telling you that we'll always be the air for you. And here are my resources. Thanks for listening, you guys.